And I realized there is a gap. Uh, like Dr. Pinto was saying, misinformation thrives probably when the stakes are higher. I rather sense that misinformation thrives when there is a lack of information. And the lack of information can be about anything. It can be about a very simple thing for a young girl going through puberty on how to cure pimples. And we have so many misinformation out there which asks you to put on Colgate to Vicks Vapor Up to everything on your pimples. Now, apparently, those are not consequential, though the stakes are not high. But we don't know. The biggest problem that we see with health misinformation is a very little of its effect is measurable. And because the effect is not measurable, hence defining the problem itself becomes very difficult.
Yeah.
So that's exactly where we thought we will start something which will educate people on the right information. We generally do not work with content writers or journalists. We have doctors on our team and doctors outside, external panel of doctors who's constantly helping us create the content. While creating credible information, we've realized that it cannot happen without fact checking misinformation because there's so much of it that needs to be tackled. Hence, we got into fact checking. And as you said, yes, we are working with companies like Meta and Google,
Sure.
helping them weed out misinformation from the internet.
Yeah. Dr. Pinto, we spoke so much during the time of the pandemic as well, and similar situation is what we had tackled back then. How do you ensure that a papad is not curing cancer? How do you ensure that one particular, drinking cow urine is not going to cure, COVID? And all this, it's been there in the system for a while. And I don't want to blame it only on the celebrities as well, because they only know so much. They have a responsibility towards their followers. But would you say the responsibility is largely with the viewer? It's buyer beware kind of a philosophy. We need to know what we're consuming, right?
So unfortunately, in medicine, the gap, what we call the knowledge asymmetry between the person buying and the person selling, is so large that misinformation fills in the gaps, right? Misinformation fills in the blanks which exist. So I think it's very difficult to, or it may not be appropriate to expect a naive, not necessarily educated in the field layperson to update themselves on the knowledge that's there, which is why I think there is a certain responsibility that all of us in the healthcare industry, whether it's doctors, whether it's the media, to kind of bridge that gap in a more rational and sensible way. There's a concept called pre-bunking or persuasion, right? So before misinformation enters the field, it's our job to flood the field with real information, so that misinformation has then to compete with us rather than us trying to firefight once the misinformation is out there.
Yeah.
I think when it comes to medicines and medical care, one of the simple rules that I tell all my patients is, go to a country that has socialized medicine where the taxpayer pays for medicines and see if it's being used, a particular drug is being used in that country, right? So that's a useful. So for example, there are nice guidelines for the UK, which tell you what drugs are approved after a very stringent set of criteria, because at the end of the day, it's the taxpayer money, so they have to make sure that the drug fits all the right categories before it's rolled out. So if it's used in a country like that, chances are that the drug has a decent amount of information behind it. Unfortunately, in India, as we saw in COVID, a lot of drugs were used in our country which were not used anywhere else in the world, which is unfortunate.